You've been told your anxiety is just stress or just hormones or was just in your head. But what if I told you there's a treatment that uses magnetic pulses to stimulate your brain and it's helping many people treat their crippling depression and anxiety? And stick around because I'll reveal the one thing that determines whether TMS will work for you or waste your time and money. Hi, I'm Dr. A. I'm an integrative psychiatrist and lifestyle physician. Let me tell you about Erica. She's 47. For 2 years, her anxiety had been relentless. Racing thoughts at 3 a.m., chest tightness that made her think she was having a heart attack, snapping at her kids over nothing. But she was also struggling with depression. She tried therapy, she tried medications, minimal improvements. She continued to struggle. Then I told her about TMS, transcranial magnetic stimulation. She looked at me and said, will this actually help my anxiety and depression, or is this just another expensive experiment? Here's the truth. TMS isn't FDA approved for anxiety. It's approved for depression. But here's what's fascinating. When depression improves, anxiety often improves too. And doctors are now using TMS off-label for anxiety disorders with remarkable results. So let's break this down. What is TMS? It's a non-invasive procedure that uses magnetic pulses to stimulate specific areas of your brain. Think of it like a targeted reset button for the circuits that control your mood and anxiety. No anesthesia, no surgery. You sit in a chair, a magnetic coil is placed against your scalp, and for about 20 minutes, it delivers gentle pulses that activate underactive brain regions. Now, here's where it gets interesting for women over 40. During perimenopause and postmenopause, your estrogen drops, and estrogen is like fuel for your brain's mood-regulating circuits. When it declines, those circuits begin to misfire. That's why anxiety can suddenly spike, even if you've never struggled with it before. If you find this video helpful, subscribe to this channel so you don't miss future content on reclaiming your mental wellness. So does TMS actually work for anxiety? Studies show that when TMS treats depression, anxiety symptoms improve in 50 to 70% of patients. One study in the Journal of Clinical Psychiatry found that TMS significantly reduced anxiety scores even in people whose primary diagnosis was depression. Another study showed that women with treatment-resistant anxiety who received TMS experienced meaningful relief within 4 to 6 weeks. But here's the catch, and this is critical. TMS works best when your anxiety is closely tied to depression, what some people refer to as anxious depression. People with both conditions usually respond better and more predictably to TMS. Pure anxiety without depression is less likely to respond robustly, but treatment can still be worthwhile for some individuals. Now, let me tell you what happened with Erica. She started TMS, 36 sessions over 9 weeks. By the third week, she noticed a shift. The constant dread started lifting. By week 6, she was sleeping through the night. By the end of treatment, she told me, I feel like myself again. I didn't realize how much I'd been suffering. Here's what most women don't know. TMS isn't just about zapping your brain and hoping for the best. It's about targeting the right brain regions. But TMS isn't a magic bullet. It works best when combined with other strategies, medications, hormone optimization, anti-inflammatory nutrition, stress management, quality sleep. This creates the foundation for your brain to heal. TMS accelerates that healing. Now let's talk about what to expect. Each session lasts approximately 20 minutes, but there is also the theta burst protocol, which typically lasts about 3 minutes. It's 5 sessions a week, totaling 36 treatments. You're awake the entire time, you feel a tapping sensation on your scalp, you can drive yourself home afterward. No downtime, no recovery period. So what are the most common side effects? Mild headache or scalp discomfort, usually temporary. The biggest question I get, is it worth it? TMS isn't cheap. It can cost thousands of dollars, but many insurance plans cover it for treatment-resistant depression. And if it gives you your life back, many people say it's priceless. Now, if you're wondering whether medications like SSRIs could help your anxiety during menopause, watch this next video where I break down the pros and cons of a common SSRI used to treat depression and anxiety and alternatives to medications.